Hello everyone. In this session, we are going to cover an important topic that is gout. In your exam, you get a long question or more frequently you get a short question, especially on the pathogenesis of the gout or gouty arthritis. So you can get a question on acute as well as chronic gouty arthritis. So let's start the topic. So here you can see we are starting the topic that is gout. So first of all, this is the overview, the headings under which I'm going to discuss this topic. So first of all, I will let you know the definition, what is gout. Then we will see the classification of the gout. Then we will see the etiology, pathogenesis. Finally, we will see the gouty arthritis, the morphology of the gouty arthritis, acute as well as chronic. I will tell you the morphology of both of them, pathogenesis of both of them as well as morphology of both of them. And finally, the clinical features. So let's start the gout. What is the definition of gout? Gout is hyperuricemia. I mean, when the uric acid concentration in the blood, in the serum is more, it is hyperuricemia. Hyper means more, uricemia means uric acid. So when the concentration of the uric acid is more, that is hyperuricemia, and hyperuricemia is gout. So gout is a heterogeneous group of the disease. In all of them, there is one common feature, that is hyperuricemia. So when the plasma urate level is more than 6.8 milligram per deciliter, please learn the value. When the plasma urate level more than 6.8 milligram per deciliter, it is known as hyperuricemia. Then the urate will form the crystal. Urate crystals, uric acid will form the crystals. Normally, uric acid is soluble in the plasma. But whenever the concentration is more than 6.8 milligram per deciliter, then urate crystals are formed. And these crystals are getting deposited in the joints and the kidney, and that is known as gout. So this is the definition of the gout. So what is gout? How you will define gout? Gout is hyperuricemia. So when the uric acid concentration in the blood is more than 6.8 milligram per deciliter, at that time the uric acid will form the crystals. It will crystallize and the crystals will get deposited either in the joints or in the kidney, and that is gout. So this is the definition of the gout. Please learn it. Now coming on the classification of the gout, there are two types of gout: primary gout, secondary gout. Primary gout is 90%, it is more common, and secondary gout is only 10%, it is less common. Primary, no other disease is associated, only hyperuricemia is there, and it is not associated with any other disease. And in secondary gout, hyperuricemia is the result of some another disease. Hyperuricemia is not primary. Hyperuricemia is due to result of some other disease. So hyperuricemia occurs in both the gout, whether it is primary or secondary. Because I told you gout is hyperuricemia. So if I say primary gout or secondary gout, it is a gout. So gout means hyperuricemia is there. But in primary gout, there is only hyperuricemia, no other disease. In secondary gout, there is some other disease which is leading to hyperuricemia. Now, hyperuricemia in primary as well as secondary gout can be due to two reasons. Either there is increased production of the uric acid. The uric acid production is more. So uric acid is more produced. Uric acid is produced as a metabolite of the purine metabolism. It's the end product of the purine metabolism. Or its destruction is less. Decreased excretion or decreased destruction. So either the production is more or excretion is less. Either the production is more or excretion is less. So why the production will be more? Either there is increased dietary intake of the purine. I'm saying gout, uric acid is the end product of the purine metabolism. So someone eating the diet which is very rich of the purine. So more and more purine will be metabolized and more uric acid will be formed. So increased production. Or there is inborn error of purine metabolism. So it also lead to increased production. Or there is decreased excretion. So in secondary gout, there are certain other diseases which leads to hyperuricemia. For example, increased production, there can be certain tumors which is having high turnover. So like the leukemia, some cancers, and the tumors which are treated by the chemotherapy, tumor lysis syndrome. So more and more tumor cells are formed, more and more tumor cells are destroyed. When the tumor cells are destroyed, the nucleus contains the purine. The purine get metabolized and increased production of the uric acid can take place due to purine end product. Purine metabolism end product. And due to decreased excretion, maybe there is some chronic renal disease. So the kidney cannot excrete the uric acid. So the classification of the gout, let me simplify. There are two types of gout. Primary gout, secondary gout. In primary gout, there is only hyperuricemia. It is not associated with some other disease. In secondary gout, the hyperuricemia is due to some another disease. So there is some other disease. The disease is leading to the hyperuricemia secondarily. So that is the secondary gout. Now each of them, whether primary or secondary, there can be two causes. Either there is increased production or decreased excretion. Either there is increased production or decreased excretion. So can you enumerate some examples in each category? So increased production in primary gout can be due to increased dietary